Welcome, everyone. Thank you for tuning in to this important discussion about protecting immigrants during the COVID-19 pandemic. The webinar has been organized by the Jewish Council for Public Affairs, which some of you may know as the JCPA, the national network hub of the community relations field. During the pandemic, the JCPA is not only working to address the specific needs of the community at this time, but also raising awareness and advocating for those who are most at risk and vulnerable in our society. My name is Arlene Fickler. I'm the chair of the Jewish Community Relations Council of the Jewish Federation of Greater Philadelphia. I'm also a community representative to the JCPA Delegates Assembly. I was privileged in September to participate in a JCPA fact-finding mission to the Arizona-Mexican border, where I saw the situation firsthand and had the opportunity to meet with immigrants, government officials, and many others to learn more about the complex issues inherent in the public policy debate about immigration to the United States. As a follow-up to that experience, it is my honor to be facilitating this conversation today. As a Jewish woman whose grandparents fled the pogroms of Eastern Europe in the first decade of the 20th century, and whose niece came here from the Ukraine approximately 90 years later, I empathize with those seeking to escape persecution, hoping to find freedom and a better life in the United States. And I believe strongly that we must welcome the stranger. Immigrants are among the most vulnerable during this pandemic. Tens of thousands of asylum seekers and children are being held in detention facilities and unlicensed shelters that lack medical care, shelter, food, clean water, and basic sanitation. Those facilities are already breeding grounds for disease. At the same time, many undocumented immigrants fear arrest and deportation if they seek medical attention. Today, we will hear from two speakers. They will describe the current situation for immigrants, both those being held near the border and those living around the country. They will also discuss what we can do to advocate for immigrants' rights and well-being during this pandemic. After we hear from our two speakers, we will take your questions. You can write your questions in the questions box on the right side of your screen. Our first speaker is Dr. Altaf, Saadi, who is a neurologist at Massachusetts General Hospital and an instructor of neurology at Harvard Medical School. She is also an expert member of the Physicians for Human Rights Asylum Network and the associate director of the Massachusetts General Hospital Asylum Clinic. She is working directly in the medical sector with the immigration community. You may have recently read her op-ed entitled, "COVID-19 shows us why we should keep ICE out of hospitals." Our second speaker is Kerri Talbot, the Director of Federal Advocacy of the Immigration Hub. She leads the Immigration Coalition, in which many diverse civic and faith organizations, including the JCPA, join together to advocate for immigration rights in the United States. At the Immigrant Hub, she works with nonprofit organizations and Congress on policy and legislative advocacy to promote fair treatment of immigration and refugees. She will provide us with advocacy steps that can be taken in our local communities and nationality. Dr. Saadi.
Thanks so much. Hi, everyone, and it's great to be here on this webinar, and I'm excited for our conversation. Just a little bit more about myself. As part of both my work with Physicians for Human Rights as well as the MGH Asylum Clinic, I have conducted evaluations of asylum seekers both in the community but also in immigration detention, including in California, Texas, and in correctional facilities here in Massachusetts. I'm also a researcher as well as a clinician, and I've conducted research in the migrant health space. So I'm talking to you today wearing all those hats. And I'm going to briefly talk about three major topics. So one, COVID in the immigration detention context. Two, COVID and the disproportionate impact in our immigrant communities and what we're seeing on the ground now. And three, COVID in the immigrant healthcare workforce. So starting with COVID in the immigration detention context. Medical professionals have documented the lack of access to basic health services and exposure to new health risks inside immigration detention centers for more than a decade. Right now, there are about 45,000 people who are detained in these settings across the US, and COVID-19, like outbreaks before it, so just last year we had outbreaks of mumps, measles, flu, enters into whatever detention settings exist. That includes close quarters of these facilities combined with unsanitary conditions like lack of basic hand washing, social distancing, and access to health services. And this makes detention settings ideal incubators to promote the spread of COVID-19. So just to give you some concrete examples from visits that I have done, I've seen 60 to 80 people using the same water fountain or accessing only 2 toilets that are very infrequently cleaned. And I think those are just some examples of the lack of sort of basic hygiene and inability to maintain social distancing that exists in the detention context. And the introduction and spread of the virus is often facilitated by staff who come in and go each day across 2 or 3 shifts. And in fact, the early cases that have been identified often start with staff, followed quickly by detained people. So for example, in a 2-week time span, the New York City jail system went from 2 cases to 38 to over 500. And this trajectory we expect is going to be replicated throughout the ICE detention system, which are typically operated by private prison companies and replicate prison-like conditions. And in this way, ICE is not only exposing almost 50,000 people to heightened risk of serious illness and death, it's also doing the same for the staff who work in these settings. I want to also point out that in addition to this, what's particularly concerning is ICE's lack of transparency. So there's an adage that goes, you can't manage what you don't measure. And ICE has reported only a handful of individuals in ICE custody that have been infected by COVID. I think the last set of numbers was around a dozen, but that's inconsistent with information provided by advocates and detained individuals. I myself was involved in an evaluation of a detention center in California where it became obvious to us that ICE was underreporting the number of suicides in that facility, because just the number of people we had spoken to as part of our tour and trip, there were far more number of people who had attempted suicide than that facility had reported in the past year. And this is a trend that has been reported across detention facilities. And I think we're seeing the same trend here, with ICE likely underreporting its numbers, and there also being significant lack of COVID testing in the facilities. A related concern is that because of the pandemic, individuals in detention are not receiving proper access to their lawyers or families and becoming increasingly isolated. And this has ramifications not only for their mental health, but also they're winning their immigration cases. So because a lot of immigration courts are still open and deportations are still proceeding, this access is crucial. And just to give you an example, I was scheduled to conduct a virtual medical evaluation for an immigrant detained in New Mexico just last week. And the facility had purportedly just set up their virtual visit sort of software platform. And I was unable to connect with the individual even after 3 hours of trying to troubleshoot the software with them. We're trying again this week, but it is something that I'm really concerned about in terms of access of these individuals in ICE detention. So some recommendations sort of moving forward that I think we can advocate for is considering how the number of people entering detention centers is reduced, or how the numbers within detention centers can be decreased by releasing people into the community, especially those who are older and have chronic illnesses. Really pushing for standardized and transparent data collection and making that information public, pushing for evidence-based plans in place to identify or house together people with suspected or diagnosed COVID-19, and for communicating to those who are detained and their families and staff. So I saw a report, for example, that at one detention center, there were CDC posters about COVID-19 that were up, but they were only up in English. So I think the bottom line is that we can't go on with business as usual right now. And I think what the message should be that whatever you think about immigration detention or immigration reform in the long term, what we can say confidently now is that detention and congregation of people in institutional settings is dangerous. It's dangerous for the people who are detained. It's dangerous for the staff, and it's dangerous for the community who interact with the staff. Just as a resource for people, just this morning, Freedom of Immigrants launched several tools to aid in information tracking on ICE's response to COVID-19, including a hotline. So I would encourage people to check that out. Along the U.S.-Mexico border, the border has been closed, and the Trump administration is forcing individuals to remain in Mexico while their asylum case is being processed. And I think what that means is just a lot of individuals are stuck in camps on the Mexican side of the border, also without adequate healthcare or proper means of social distancing, and just very concerning from a public health standpoint. But I'll move on to sort of the second topic that I wanted to briefly talk about, which was how COVID is affecting our immigrant communities. So there are three main points that I wanted to bring up. One is the reality and concern about continued ICE raids and immigration enforcement. Second is concerns about public charge. And third is the reality that pre-existing health disparities and social conditions that exist that make immigrant populations especially vulnerable in this time. So to start off with the issue of ICE raids. So ICE still has not stopped creating fear among immigrant communities by continuing its enforcement operations across the country. There were reports of immigration enforcement activity still happening in late March, even though ICE had reportedly said that they would be limiting this activity. And at a time when hospital workers and paramedics don't have personal protective equipment to care for their patients, ICE has even requested thousands of masks for their enforcement officers to make arrests in the community. And from a public health standpoint, that's obviously counterproductive. And I do want to emphasize that this fear created by ICE is not new. There have been numerous studies that have shown physical and mental health consequences to this fear of accessing healthcare, but it's especially troubling during a pandemic because when immigrants fear obtaining adequate healthcare, viruses like COVID-19 spread through our communities at large. And we're seeing this on the ground. So even particularly around concerns about information disclosure. So you might know that across the US, healthcare facilities are ramping up telemedicine services or conducting virtual visits. But what we're hearing from immigrant communities is that they're even concerned about participating in these services because of who might be able to access it. So this is a question that's come up is who will see this video? If I do this phone call, who is going to be have access to it? I conducted interviews 2 years ago across 5 states that have the largest undocumented immigrant populations about how the US presidential election was affecting immigrant communities. And at that point, a provider had described the spread of fear itself like the spread of an epidemic. And I think that that's a really helpful analogy here, to think about an epidemic of fear that exists in immigrant communities within the larger coronavirus pandemic. Second, while many immigrants fear accessing healthcare, a lot of them do so because they worry about becoming a public charge and risk being denied visas and green cards. So USCIS has confirmed that testing, treatment, or preventative care, including vaccines, if a vaccine becomes available, anything related to COVID does not apply to public charge. And I think it's really important for us to try to get this information out there and adequately disseminate it to immigrant communities to ensure that their fears are addressed. And again, this is on top of pre-existing misconceptions. So one of the things in my role that I find I often have to explicitly communicate is that refugees and asylum seekers are exempt from public charge, or the public charge rule. And I think, again, this goes part of a larger mission that we should make a priority, is disseminating accurate information around public charge and other fears that immigrant communities have at this time. Third, it's also important to emphasize that this fear about immigration enforcement exists against the backdrop of existing disparities. So I mentioned telemedicine, and this is something I'm seeing in my practice right now. I'm doing virtual visits, but people might not have access to Wi-Fi, or may even be difficult to reach by phone because they don't have a monthly plan. So our responses need to acknowledge this reality and need to include some creativity. Other factors to keep in mind that impact immigrant communities disproportionately is many immigrants live in high density neighborhoods and homes without access to cars, and so can't adequately protect themselves through social distancing measures. And similarly, a lot of them are considered quote unquote essential workers. So working in hospitals or nursing homes or food packing facilities as farm workers. And so they are on the front lines, even though we don't typically think of them as on the front lines, but they are. It's not just healthcare professionals, and they're more likely to be infected as a result. And to give some ideas of just why, of the creativity in addressing these problems, I'll mention again just from my clinical practice. I work at a community health center that serves a predominantly immigrant population, and the city and local organizations there have tried to connect neighbors with one another to share Wi-Fi passwords, for example, just during the outbreak. We've had to communicate patients by phone instead of video, or use trusted platforms like WhatsApp instead of Zoom. So again, just being open and flexible to the needs of the community. And from the standpoint of offering services, we also need to think about facilitating communication for patients with limited English proficiency. So the CDC on their website has COVID-related information in Spanish, Chinese, a few other languages, but it's important that such information is translated in as many languages as possible and widely disseminated. I do want to share a local resource. And hi, if you could just pull up the next slide. The MGH Disparity Solution Center has on their website a broad variety of COVID-related information that's been translated in many languages, and I hope that that's a helpful resource, but that's all been collated on their website. Third, I want to just talk about COVID and the immigrant workforce. A lot of times we think about immigrants as just our patients, but immigrants are also our colleagues and people who work in our healthcare facilities, people who work in any organization we're a part of. And as a doctor, I know, and I think a lot of people know, that about 1 in 3 physicians are immigrants, but there are a lot of other immigrants that make up the healthcare system that are also immigrants, including 17% of registered nurses, 25% of home health aides, nursing aides, and so many more: translators, janitorial staff, food service employees. And without these immigrants, we would not be able to provide adequate care to effectively respond to COVID-19. So I think healthcare institutions, but really any organization, needs to think about adequately supporting all their workers across the employment tiers. One of the things, again, I'm just bringing up from personal example, our institution has been sending out daily emails. But one of the feedback that was received within the institution was that a lot of people might not have access to email. And so our hospital has been hosting individual meetings, let's say with the janitorial staff or food service employees, to make sure they're getting the same information and that they're not receiving information just because they don't have access to email, for example. And I'm going to wrap up by just making a plug for Doctors for Immigrants, which is a website that my research team and I put together based off of a multi-state research study I conducted. I mentioned it previously. I conducted about 40 interviews across 5 states that have the largest undocumented immigrant populations. It's California, New York, Texas, Florida, and Illinois. And we identified a dozen or about a dozen policies and actions that can be implemented at the healthcare facility level to address fears of immigrant patients and the needs of immigrant healthcare workers. That's available on doctorsforimmigrants.com, and I encourage you to visit the website. We have a toolkit and videos, and share the resources, including with any physicians or healthcare administrators you may know. I think that's in terms of what I was hoping to cover, and I'm really looking forward to the Q&A.
Thank you very much, Dr. Saadi, for your very poignant and important presentation. Your firsthand knowledge makes the situation faced by immigrants very real and understandable to those of us who are watching this webinar today. Thank you for the very important work you are doing. We will now hear from Kerri Talbot, and please remember to put your questions in the questions box on the right side of the screen. Take it away, Kerri.
Sorry, I just had to unmute myself. Thanks so much. I really appreciate being here, and thanks for joining. So I wanted to just talk through what has been included so far in legislation related to immigrants, and then talk a little bit about what our hopes are for the next package that we're hoping Speaker Pelosi will push through in the coming weeks. So first, I'll talk a little bit about the gigantic stimulus funding bill that went through Congress just about a week ago. This bill was primarily focused on corporations and also on unemployment, but it did include important provisions related to health. Unfortunately, they were not targeted to immigrants, but some of the general provisions will be helpful to immigrants and to other communities. So that bill did include $100 billion for hospitals, which the Trump administration has said that they are going to use that money for the uninsured. We don't really think that it will pay the specific hospital bills of immigrants, but it will certainly help hospitals stay afloat as they provide care to individuals who are uninsured. And then there were also several pots of money that just are open to state and local actors that will help them provide some emergency relief, as well as $450 million for food banks, which is helpful, as well as $3.5 billion for the Child Care Development Block Grants, and also an increase of funding of about $3.3 billion for community health centers. And that's really where we anticipate that immigrants will continue to go to receive testing and to consult with physicians is at the community health centers. Unfortunately, though, one really huge gap that was not addressed is Medicaid, emergency Medicaid, or cash assistance for immigrants. And so I'll talk about that in a few minutes when we talk about what we're hoping for the next bill. In the stimulus bill that did pass, there were a few immigrant-specific provisions, including related to individuals who file their taxes with an individual taxpayer identification number. So these are people who are immigrants to the US, so they may not have social security numbers. And we wanted to try to open up cash assistance to people who file their taxes with what's called an ITIN, or an individual taxpayer number. They did open it up for military families, so that was helpful, but they did not include it, the cash payments for people just filing with an ITIN who are not in a military family. People who have social security numbers, though, can get cash payments. So that would include some folks like those who are dreamers and folks who have temporary protected status. There also was some money related to migration and refugee assistance, and this will be helpful overseas related to refugee resettlement. And thankfully, there was no money for ICE or Customs and Border Protection. So there was not money included for immigration enforcement, which we thought was positive because we don't want to have more of a crackdown on immigrant communities funded by the bill. And then finally, the stimulus bill did focus quite a lot on unemployment insurance, as you might have heard. Immigrants are only eligible for that if they are work authorized. And so many immigrants may not be work authorized, or they may fall out of status and then become not work authorized just because they may be laid off. So not all immigrants receive unemployment insurance. So that's just a short summary of what's already passed. So basically, there was a lot of general money there for hospitals and for community health centers, but there was not much by way of specific assistance for immigrants, and there was no medical coverage for immigrants. So next, I'll talk a little bit about what we're hoping for the next package, which Speaker Pelosi is starting to put together. And so we're hoping it will move forward in a few weeks. There is the challenge, of course, of not being able to come to Washington right now due to the threat of the virus. So that is impeding some of the legislative work, but we're hopeful that they'll be able to negotiate a package some point in April. So I want to just walk through a couple of the key items that we'd like to have included in the bill. Those include providing no-cost testing and treatment for everyone. We need to make sure that immigrants can access treatment for coronavirus through emergency Medicaid. And we want everyone to be able to access treatment through emergency Medicaid. So that's probably our number one ask. If there is more cash assistance, we also would like as many people as possible to be able to access cash assistance, because obviously the economy is in trouble right now, and we just want to make sure families are receiving assistance. At the very least, we want to make sure US citizens are getting assistance. And as it is right now, mixed status families, or those where there's US citizens and immigrants living together, they are not able to access payments. And so that is a big problem. And we'd like to make sure that especially people who have US citizen children are able to get money related to having those kids, and make sure there's enough money to keep their houses, safe and keep food on the table. So those are two very important health-related issues. Next, we're also hoping that it would be possible to do an automatic extension of people's work permits who are dreamers or people who have temporary protected status. We want to try to keep them protected. As you may know, the Trump administration has attempted to remove their ability to stay in the US, and this is obviously not a good time to be losing folks, especially, a lot of these people are in very important professions. There are actually tens of thousands of healthcare workers who are dreamers. A lot of people with TPS are in essential occupations, many farm workers, etc. So we just want to make sure that people are able to continue doing the essential work that they do to keep our country functioning. And so that would be aided if we were to do automatic extension of work permits. Next, we want to keep making sure that there's no money for ICE, Immigration Customs Enforcement, or for Customs and Border Protection, because we don't want crackdowns right now when we don't want people to be scared to go to the hospital. Next, we want to just make sure that language is not a barrier to getting testing or treatment. We have heard a lot of stories of individuals who have no idea what's happening to them. They're being put on an incubator. They're being intubated and they don't know what's going on. So we want to make sure that there's enough language assistance. And we would like to halt the public charge rule, which the doctor spoke about a few minutes ago. So those are our main asks for the package. And I would just say that, our overall message is that we really want to make sure everyone is safe, that everyone has access to testing and treatment. Because if everyone doesn't have access to that, then we're just putting the rest of the community at risk. We want to make sure everyone can find out if they need to be in isolation for the 14 days. We need to know if people are sick, and we need them to be able to go to the doctor for all of us to be safe. Thanks so much.
Thank you, Ms. Talbot, for explaining to us both the legislation that's been passed and the things that you're proposing be included in the fourth package, so that we can help immigrants who are confronting the same problems that many of us are confronting during this pandemic, but confronting them when they're simultaneously feeling vulnerable and targeted in our community, in our country. And so I thank you for the work you're doing to advocate on their behalf. And so I'd like to ask both of you, and I guess I'll start with you, Ms. Talbot, what can we in the Jewish community do to increase the likelihood that the items, the provisions that you discussed in the proposed fourth bill are likely to pass?
Great, thank you. That's such a good question. And I really hope we could have your help with reaching out to your members of Congress to ask them to please protect everyone in the next legislative package. We really want to make sure everyone has access to testing and treatment. And so if you could mention immigrants and refugees, if you call your member or email them or tweet at them, that would be incredibly helpful. Because right now, obviously, there are just so many issues out there, and it really is challenging to break through to members and break through to the media. And so the more we can do to just raise awareness about this issue, it would be really a big help to your immigrant neighbors and people who work in your community.
Thank you. I guess, Dr. Saadi, I'd ask you the flip side of that question. You mentioned a number of policies and actions that hospitals and other health facilities can take to protect and support immigrants. How can we in the Jewish community be helpful in bringing about those changes?
Yeah, thank you for that question. I think one of the things that's helpful to do is to ask, so let's say in the context of a clinic or a healthcare facility, is to ask what policies have already been implemented. So just to give you some examples of those that could relate immigrant patients' concerns. Is there communication around what is being recorded in medical records, for example? So a lot of patients worry about, is information about my immigration status being documented in medical records? The answer should be no. And is there a mechanism to sort of communicate that? So I think sort of holding to task people who are in leadership roles and asking them, are you thinking about the needs of the immigrant community, and what is proactively being done rather than, always as a reaction to how immigrant communities are being impacted?
Thank you. Both of you mentioned in your remarks the public charge rule. Can you explain that to our audience and tell us what kinds of immigrants it applies to? Does it apply, for example, to undocumented immigrants? Either of you.
You want to go ahead?
Yeah, so I'll pull up the, in terms of who specifically it applies to, but there are certain people that are excluded from its application. So essentially the public charge rule is a determination by DHS when they're determining if a foreign national is going to become quote unquote a public charge, and so making them inadmissible or ineligible for admission to the US or adjustment of status. So it doesn't apply to refugees, asylum seekers, certain non-immigrant victims of T visas and U visas. So some of those could be undocumented immigrants. and a lot of undocumented immigrants are asylum seekers themselves. Foreign nationals who are applying under VAWA, or the Violence Against Women Act. So there's a lot of sort of provisions in terms of who it applies to and who doesn't. I think the biggest change that we saw with sort of the new rule that was passed earlier this year was in terms of what constitutes a determination of public charge. So including using Section 8 housing, SNAP. So there's just in terms of concern about accessing these public benefits and that affecting someone's immigration status. Kerri, if you want to jump in and add anything.
Yeah, that was great. And just to put a fine point on it, so it applies when you're doing an adjustment of status application. So that's a green card application. So it doesn't apply when you're trying to do citizenship, does not apply to undocumented immigrants. So it's just when you're trying to get a green card and you're in the legal process. They are starting to ask for proof of income and how much work you do and where you live and how many benefits you've used, et cetera. And then they're going to do this balancing test to see if you're rich enough basically to get a green card.
The doctor, you described the risks and the conditions in the detained population. Do those conditions in detained populations and among immigrants with respect to increased risk of incurring the COVID-19 disease, does that increase the risk with respect to the general population?
Yeah, so again, I think with this, so there are multiple ways that can happen. A lot of it is because the staff is interacting with all these individuals, and then the staff, right, are going out and interacting with people in their communities. At the same time, if there are people who are working with the individuals that are detained, so whether that's the lawyers or their families, all of, these are all additional people who are coming in contact. And so, yes, there can be sort of risk to the general population that way.
Okay. If the detainees were to be freed from the detention facility centers and they're released, where would they go? And are there any organizations working on that, if you know?
Yes, yep. So there are actually a lot of sort of different pending lawsuits led by different organizations. I know I was previously in California. Some of these lawsuits have been led by the ACLU. I think there's sort of different legal organizations here in Massachusetts that have led that. But there have always existed alternatives to detention. And so a lot of individuals who have family members and they can sort of get released to their family. And these alternative to detention programs have been shown to be just as effective in terms of keeping tabs on this population. The people still show up to their immigration court hearings to follow up with their cases. And so we know they're just as effective, but they're more humane. And from a public health standpoint, certainly would reduce the risk of individuals from being in, a tightly confined space with little access to, basic hygiene or healthcare services.
Okay, thank you. Ms. Talbot, was there any money in the for refugee settlement in the third stimulus bill? How much, if there was, and how will it be used?
The money that was included was $350 million for migration refugee assistance account. That account is used mostly for overseas refugee assistance. So there was not any money included for refugee resettlement, although the groups were definitely pushing for it, and we'll keep pushing for it in the next bill.
Okay, good. If an immigrant with work authorization is laid off, do they then lose their status of being work authorized?
Mm-hmm.
Are they able to access unemployment compensation benefits?
Yeah, many immigrants who change status do lose their status once they are laid off. So that does cause a big problem in terms of accessing unemployment. Immigrants such as people with DACA or TPS who have ongoing work authorization that is not tied to their job, they can access unemployment, but people who fall out, people like who are on non-immigrant visas, like short-term visas or related to their job, and then they are laid off, oftentimes those folks are not eligible for working and they're not eligible for unemployment insurance.
Can one of you please clarify the situation with respect to mixed family incidences? Can those who have filed taxes receive assistance individually? What's the glitch with this?
Oh yeah, yes, so it's a little complicated, but the individual filer, in terms of the tax assistance, the cash payments that people are getting, the stimulus checks, those go to people who have a social security number. And so if the kids have a social security number, but the parents do not, the family still is not getting any money, even though the kids are citizens. So basically, as it stands right now, everyone in the family has to have a social security number. And what we're going to push for in the next package would be to say that any individual who has a social security number can get payment for that individual, so that it's not requiring the entire household to have a social security number.
Okay, and so are those people who are adjusting their immigration status through the Violence Against Women Act and who have received a social security card, can they receive money from the relief package?
Yeah, anyone with a social security number can get, who filed taxes, can get a stimulus check.
Okay, good. I'm just going through the questions here. Dr. Saadi, would you please repeat the statistics with respect to the number of immigrants who are working in hospitals, particularly nurses?
Yeah, I think it was 17% of registered nurses. So that doesn't include medical assistants or sort of other. Hi, sorry, I think I just had to unmute myself for a second. So it was 17% of registered nurses, but that doesn't include a lot of other nursing roles.
Okay. Let's see. We've heard, we've all seen the stories about children in detention. Is there any specific ask that we should be including with respect to detained children with respect to the fourth stimulus bill?
Yeah, they should let them out. There shouldn't really hardly be anyone in detention, definitely not children. But also, I mean, there's as the doctor was saying, there's lots of other folks who are vulnerable, like the elderly and pregnant women, and they really need to let out as many people, or ideally everyone.
Can you tell, either of you tell us more about the status of immigration courts and open cases? What happens with the pending applications? Do they get automatically extended, or are people continuing to get hearings? What's happening there?
Yeah, it's actually
Kerri. I was just going to say, you can jump in, but I know, so from the medical expert that sometimes we're involved in the cases, I know they're still happening because our doctors, as part of our asylum clinic, are still having to call in or testify for cases. So it's still happening. It's very anxiety provoking because a lot of people are showing up, at the immigration court, and they might be limiting who gets into the court space itself, but they're not really monitoring the waiting areas. And but anyway, sorry to interrupt you, Kerri. You can sort of add what you were wanting to add.
What I was going to say, that it's really putting people at risk to keep the courts open. It's actually totally ridiculous. I mean, pretty much almost
Yeah.
everything is closed, but they're making attorneys go in person into court and clients, and it's very dangerous.
I was on a highest conference call last week about this same situation, and they were urging people who are particularly fluent in Spanish to volunteer, both to help with intake over visually, and for attorneys to assist in being able to present claims, and they're looking for translators with respect to documents. So if there are people on our phone on this webinar who have any of those skills, particularly who are fluent in Spanish, I would urge you to look at the highest webpage, because they also have opportunities for volunteering, so that we can take action in helping to advocate on behalf of the immigrant community. I don't know if either of you can speak to this, but why are international human rights laws not addressing the crowded, unsanitary situations in detention camps? Since these are the reason why the detention camps can very easily become death camps.
Yeah, it's true. I mean, it definitely, I would argue, violates international law and international human rights law and norms. But, you know, as has always kind of been the case, you know, international law is not always followed in the US or by the US. So unfortunately, it's been a challenging situation, but there are some litigators who have succeeded in getting courts to let out individual detainees. So that's been helpful, but I mean, it's so difficult to do all that litigation just for one person or a small group of people when there's still 35,000 people in detention. And so really it's up to the government to let people out. But we have been saying that, you know, putting pressure on your local ICE, if you happen to know the district director, or if you can join, you know, in whatever work is being done in your local community with the ICE local staff, there is some ability for the local folks to let people out as well.
What are the alternatives to detention, and are they effective? And how can we encourage, as you suggested, more people to be released?
So my understanding is, and this was actually a big shift under the current administration. So beforehand, individuals were deemed either to sort of be high flight risk, and if they sort of didn't have if they sort of didn't meet certain requirements, they would be detained. But if, let's say, they had family that they could go to, or they were caregivers, or someone who had a disability, or they had certain chronic conditions, they would just be released to their community members or someone who could that they could stay with, and they would just be checking in as their case proceeds through the legal process. And my understanding is that you know, one of the big concerns is, oh, well, do these people still show up to immigration court? And the numbers from what we, you know, call these alternatives to detention are just as high. So you have, you know, over 95% of people who are still showing up to their immigration court hearings. You know, people are wanting to go through the process and sort of doing what, you know, going through this legal process as well as they know. So I think we really should be trying to push for that, but we've seen a big shift under the current administration.
Yes, I'm sure. I know that to be the case. I know that to be the case. Sorry. Sorry. We've been talking about detention facilities. I think
Arlene, you've been muted.
Arlene? Better?
Yes, thank you.
Sorry, I apologize. I thought I was hearing an echo. I apologize. We've been talking primarily about people in the detention facilities here in the United States. Is there anything that we can do with respect to the people who are being held in Mexico before they can even make their first case or make their second case with respect to access to coming into this country?
You know, I think at this point, especially with us needing to stay in our homes, a lot of it is thinking about potential places to donate money to that they could sort of provide these resources for individuals. So I know Physicians for Human Rights organization I work with certainly has worked with legal organizations at the U.S.-Mexico border and sort of other organizations that are trying to improve access to care at the camps in that space. Kerri, I don't know if you have any additional thoughts.
No, yeah, I think it's really scary that, you know, the individuals who are remaining at the border are definitely at high risk of catching the virus. And also I would just note that it's totally ridiculous also that we've been exporting the virus. You know, we have actually deported people to Guatemala who had the virus when we're much more of a hot spot than Central America is for the virus. So I think it's really sad that this administration's focus on deporting and detaining immigrants is really overshadowing their common sense in terms of dealing with the virus.
I've talked about HIAS. Dr. Saadi has spoken about Doctors Without Borders. And are there other organizations, international organizations, domestic organizations that our listeners can make contact with who might be able to help with the problems that you've both been discussing?
I know from the detention standpoint, I'd also recommend Freedom for Immigrants that I think I mentioned just today launched a COVID hotline and has really been at the forefront of a lot of detention work. And then I would really encourage people to look within their states or just local organizations. So I can speak in Massachusetts. Just in Massachusetts, there is a mass Undocumented fund, for example, where people can donate to. There is a lot of local organizations that have access to these communities that are trying to raise money and funds for people who you know, are losing jobs or finding themselves particularly vulnerable. So I would really encourage people to just look within their state or their city at organizations that are really helping on the ground in that particular area.
Yeah, I agree too. I think there's just so many organizations across the country. We've got hundreds on our network, and I think just looking at your local organizations, like for instance, I live in Washington, D.C., and like Casa de Maryland is really important. So I think just supporting those local service providers is super important.
If we don't know somebody from ICE, is there anything else we can do to put pressure on ICE to limit their enforcement at this particular time?
I would tweet at them. That's something you can do that's pretty easy. Just put at ice.gov and say, you know, you need to let more people out. These are going to become death camps. And there's so many people already who have the virus and they're hardly even doing testing in detention centers. So I'm really worried that in the next couple of weeks, we'll just see huge amounts of deaths in custody.
What about undocumented immigrants? Are they handled any differently in our system? And what is the status of documented immigrants in terms of those are being held in federal prison and then being held in detention in the United States?
I mean, most of the folks we've been talking about are undocumented. So, you know, the top issues that we're seeing are that we do see a lot of people in detention and that they're at have a health risk and need to be released. And then I would say our top asks are that people get access to testing and treatment through emergency Medicaid, because undocumented immigrants are not getting access right now.
Yeah, I think I would make a quick point to say that a lot of these terms that we use, whether it's undocumented or asylum seekers, even refugees, a lot of times involves the exact same individuals. So someone who is in the process of having their asylum case being processed, it could be undocumented during that time. So a lot of times it's the same individuals, even though sort of different labels are being attached to them.
Do either of you have anything else that you'd like to say, particularly to our audience this morning? Personally, I want to thank you both and thank everyone for tuning in today to learn firsthand about the immigrant population, how it's been handling the pandemic, what their challenges are, and how we can help. We have been very fortunate to hear from two amazing speakers. Dr. Saadi and Ms. Talbot, thank you both so much for your presentation and for the passion that you bring to this concern. I personally learned so much and was very glad to be able to talk with you this afternoon. This webinar is part of an advocacy series on the pandemic organized by the JCPA. Following this webinar, the JCPA will be sending out an action alert as well as some of further information about the organizations and contact information that's been referenced by our two speakers. This webinar is only one of a series, and we encourage you to watch our webinar tomorrow, April 7th at 1 p.m. Eastern Time on the coronavirus and its impact on the 6 million people that are currently being held by our criminal justice system through probation and parole. That webinar will be followed at 4 p.m. by another important webinar about a faith-based response to COVID-19, co-sponsored by the JCPA and our Washington Interfaith Coalition. The listeners here today, you will all be receiving more information on these programs right after the conclusion of this program, and please look forward to our action alert about the issues that have been discussed by our speakers. Once again, thank you, Dr. Saadi and Ms. Talbot. Thank you to all the listeners. Be safe out there, and for whatever holiday you may be celebrating in this week of, in this Holy Week, I hope you have a happy holiday, notwithstanding the fact that you can't hug your loved ones. Thank you very much for joining us. Bye-bye.
Thank you.